We've got 3 amazing guests, well, 2. They're also very proficient at disappearing acts, so multi-talented over here. But I'm going to go ahead and do a little quick introduction. Hopefully our Krueger will come back here really quick. My name is Michelle Chevalier. I am the Director of Industry Partnerships for the Farm School of Business. So I work very, very hard to try and make sure that we are providing all sorts of opportunities for you as students to engage with our industry partners and to network with alumni and executives and to learn about career opportunities that you might not have been on your radar before. So with that, I'm going to do some really quick introductions of our 3 guests and then our moderators. Before I do that, one quick piece of housekeeping. We would like to take attendance to just kind of know who showed up to the event. I know some of your instructors were encouraging you to come, or may have offered extra credit or required you to come. So there are QR codes at the landing here on either space. If you scan those quickly with your thumb, all we need is your name and email address, and that'll let us know who showed up tonight. So at any point, we can go ahead and do that. So without further ado, I'm going to introduce our 3 guests here. On our far right is Dr. McCoy. He is an orthopedic surgeon for University Hospital in Cleveland. And then in the middle, we have Justin Krueger. He is the president of Mercy Health Fairfield Hospital and North Market. And then here on the end, we have Kevin Hopkins, who is a full-line sales representative for Stryker. And the discussion topic tonight, hopefully you're aware of, is the healthcare ecosystem and how these 3 people intersect just in their day-to-day business. And so with that, I also want to introduce our 2 moderators tonight. And first, I'm going to introduce David Curtin. He is a senior marketing major and the treasurer of the healthcare business sales organization. And really, he was the catalyst on how this whole event tonight came to be. He and I had a conversation a while ago about companies that he was interested or thought his peers would be interested in coming to campus, and really wanted to have more of a focus on the business side of the healthcare industry and presenting more opportunities to the students. So he's the one to thank for how this all came together tonight. So he will be your moderator for the evening for the discussion, and along with him is Olivia Holden. She's also a senior marketing major, and she's the vice president of the healthcare business sales organization. So with that, I'm going to turn it over to our 2 fantastic moderators, and I hope you enjoy the discussion. Thank you.
Thank you, Michelle. Thank you guys all for being here today, especially our guests. This is the first time that I've been able to do an event like this at Farmers, so I see you guys can consider yourself first, but I'm pretty excited about it, so hope it goes well. And at any point along the conversation, you guys have questions, feel free to raise your hand and go ahead and ask away. So for starters, I think we're going to go into a brief introduction of our guests and kind of have them tell you a little day-to-day, their jobs, what they do, their career path journeys, and maybe some job opportunities along those lines for graduate students to get into the healthcare ecosystem.
You want me to start? Sure. Is this working okay?
I believe so.
Okay.
You guys hear me?
Yes.
Okay, so I graduated from Miami a long time ago. So after undergrad, I went to Cincinnati for medical school. I went to Northwestern for residency. Then I did a sports medicine fellowship at the Cleveland Clinic. So 4 years med school, 5 years residency, fellowship with 1 year. Been in practice for 10 years. Day to day, I do predominantly knee and shoulder surgery. My time split between office and OR, like most orthopedic surgeons. Take call, all the usual fun stuff.
Justin,
Can you guys hear me okay with this? Is that on?
you guys hear me?
Yeah.
Another one that we give Justin.
Make sure. Let's do that. How's that? Better? Good evening, everybody. I'm Justin Krueger. I'm the president of Mercy Fairfield Hospital and the Cincinnati North Market for Mercy Health. I've been in Cincinnati, I guess, 5.5 years now. Originally from Tampa, Florida, and I went to the University of Florida for undergraduate and graduate school. My undergraduate degree was actually in food science and human nutrition, and I was definitely one of those that thought for sure I was going to go to either medical or dental school, so I chose that degree thinking I would knock the prereqs out, and I really had a change of heart around the latter part of my junior year into my senior year, and really decided to pursue healthcare administration. Quite transparently, I didn't even know that was really an industry up until not much longer before that. So anyway, I've got the privilege of operating hospitals in 4 different states across the country, 6 different hospitals in 4 different states. So that's a little bit about me.
Can you guys hear me? Awesome. Kevin Hopkins from Cleveland, Ohio. Graduated in 2014. Started with Stryker Orthopedics right out in 2014. I'm a full line sales representative, so I sell essentially everything in the orthopedic portfolio, total hip, total knees, and then all the fracture care. So plates, screws, nails, you fall down, break something, you probably have some hardware in your body. That's all things that Stryker sells. So that's what I'm a part of. Day to day, anything from calls at 6 a.m. for add-ons from the orthopedic surgeons later on in the day, to weekend call, late nights, early mornings, weekends is pretty standard. So it's a sales job, but it's also a service job. So you're going in and you are selling, and you are talking to the surgeon, maybe at the scrub sink, but a lot of times you are also servicing your products 24/7.
Thank you, guys. Now moving forward, I think we can go ahead and go into the example of the knee replacement patient example and kind of walk through what a patient would be going through in the healthcare ecosystem, the ins and outs of what they experience, what they go through, and kind of from start to finish their point A to point B. And then kind of throughout that, maybe if you guys could explain maybe some job opportunities that can pop up with what might happen in that patient's journey for specifically this audience. So I don't know who would want to start, maybe Kevin probably, or...
Yeah, well, I'll start and then we'll go to Dr. McCoy and then probably come back to me and then finish with Justin here. So first it would be, if a patient needs a total knee, yes, we manufacture the total knee. We're just one of multiple companies that makes a total knee replacement or a total hip replacement. So it would really start with the patient needing it. And then right after the patient needing it, it actually goes directly to Dr. McCoy. And then I can resurface later on in this process when the patient actually comes in for surgery, but I'll kick it then over to Dr. McCoy to talk through some of those steps.
Sure. So somebody has a disease process. They may not be aware how bad it is. They may start with a primary care doctor. They may end up in an ER. Ultimately, if you're going to have surgery, you have to see a surgeon. So some people know that they need it, that had it done on the other side, et cetera, but they'll come in for an office visit. They have to make sure that somebody's in their insurance network. They have coverage, et cetera. You get x-rays. You often will do non-surgical things first. And then, so, physical therapy, there's a job there. Sometimes cortisone shots, medications. So there's a pharmacy side of things. There's also medical equipment side of things. You may do bracing. When they do decide they need a knee replacement, then, so we're missing our insurance guy who we're going to pick on today, but we have to get the surgery approved. So sometimes you have to clear certain steps to do that. Other insurances are less stringent. They just kind of review your documents. And so if I see somebody that needs surgery, I basically fill out paperwork, and then they have to get preoperative labs done. Now we're getting COVID tests done. And they go into logistics scheduling, so they'll see my assistant. Usually my PA will help do some paperwork, et cetera, with them. There's an information session at the hospital, so I'll meet with the nurse and the physical therapist to teach them about their journey through a knee replacement. So tomorrow we're doing Kevin's company, I'm doing a robotic knee replacement, so we may have additional imaging and planning ahead of time. Then the surgery itself, they interact with basically everybody. So you're meeting nursing, anesthesia, physical therapy, social workers, discharge planners. Hospitals are good at getting rid of people now appropriately. So, and then after that, they'll go home. Physical therapy usually comes to the house for a few days, and they'll do outpatient physical therapy, still getting prescriptions to help with pain and blood clots, things like that. Usually work on therapy for 2 or 3 months, and then after that, it's a return to normal life.
So from my vantage point in the hospital, if Dr. McCoy is presented and he's got a patient he needs to have surgery on, everybody at the hospital needs to be ready to go for that. And that's not just the nurses and anesthesiologists and CRNAs in the OR suite, but it's all of the pre-admission testing folks, making sure that they're prepared day of surgery, it's social work, everything that the doc referred to. and making sure that, and hospitals are pretty complex organizations, and then just as an example of my hospital, it's a 265-bed community hospital licensed. But we employ 1,300 people, and it doesn't shut down. It's a 24/7 operation, and it takes everybody, all departments and processes firing on all cylinders to deliver not only a great patient experience for that patient, but for the physicians as well. And so there's a lot of movement and moving parts related to that. So once he comes in and he's doing that procedure robotically, we've obviously already had the conversation and the purchase or contractual arrangement with the robotic system. We've negotiated pricing and what that's going to be, and all that would go against ultimately what the hospital is reimbursed. And the bills themselves in healthcare can be pretty complex, and Dr. McCoy is going to drop a bill for his professional services. We're going to drop a bill for our technical services, the hospital stay and so forth. Anesthesia will drop on, you name it. And so making sure all those things are in line to make sure we're going to get paid for that procedure largely. And then when the procedure is done, making sure that that patient is discharged in a timely fashion, because with hospital billing, we're reimbursed by what's called a DRG, or a diagnosis-related grouping, and that only gives a patient a set amount of time on average for that hospital stay. And so if we are wildly inefficient or something goes awry with the delivery of that care to that patient, and they're staying longer, that eats into the hospital's operating margin for that particular patient. So he was joking a little bit, but not really, and we are really good at making sure we discharge people in a timely fashion, because it's an efficiency play on our end, and it's better patient care.
To that point, so all of the business side of thing he says, so like my billing, my coding, so if I do a knee replacement, I circle a code on the billing sheet or click it in the computer, and I give it to somebody who does it. Same with the insurance approvals. I'm not really doing any of that stuff day to day. So, you can get lost in the weeds sometimes, but every surgery I do tomorrow, my coding and billing for that will take less than a minute for each person. Having said that, there's an army on the front and back end that are working on the business side of things, and we all kind of admitted we don't completely understand it, but that's a whole different conversation.
To kind of all string together, Kevin, if you want to touch base on what your sales cycle looks like and kind of how you build that relationship with a doctor like Brett, and then Brett, how would you potentially leverage Kevin in your surgeries and so on and so forth, and then to top it off, Justin, kind of what role does the hospital play in the patient-doctor relationship?
Yeah, great question. So I would say that it's a very consultative relationship, right? We discuss, potential, having a plan A, plan B, plan C for essentially every single case. When working with Brett, something standard might come in, but I'll have plan A and plan B. So if we get into a little bit of a pickle in the middle of the case, we have a bailout option, right? So it's much more than just a sale, right? Again, it's a sale plus a service, and at least within Stryker, we are very, very careful with who we bring on, and knowing that they're going to be a for sure consultant to that surgeon, because at the end of the day, there's a patient who's on the table. That's someone's life. That could be someone's grandma. And so a lot of times I go in there and I say, if that was my grandma, if that was my mother, if that was my father, how would I want this to go, right? So that's a lot of the mentality that goes into my thinking and how I treat my patients, my customers, and then at the end, the hospital.
Yeah, I don't think Kevin's ever sold me anything or tried to sell me anything. So generally, and Justin, you can talk about this more, but for certain hospitals have contracts with specific vendors. So they may say for fracture work, we want 85 or 90% to be this vendor. So you can find niche products for rare things, but they really encourage us to use something specific. So there was a hospital I used to work at that Kevin's products couldn't really go there, right? Raised flags. For joint replacements, the Cleveland Clinic, University Hospitals both have two providers they prefer, with some carve-outs, metal allergies, things like that. So, if Kevin approaches somebody at a hospital who can't use these things, it doesn't really work. So from the sales side, really, I try to choose what I use. My relationship with Kevin is, you want people who are knowledgeable and reliable. You'll do routine things all the time, but every now and then you get tough cases. And so like my practice elective is mostly knee and shoulder. So I do a lot of scopes, some joint replacements. So if I have a really bad fracture when I'm on call, I know if somebody like Kevin who goes down to the level 1 trauma center, who's covering crazy cases, he's going to kind of have a backup and a plan, and I know he's reliable and useful. And maybe I need some you know, and some surgeons are arrogant, they won't take any advice from anybody who's younger than them, but I think in general, you want knowledgeable, intelligent people there. And then as that relationship grows, it kind of says, hey, we just bought this company, they got a really nice line, we have new things, that's great. So I try to choose companies I work with. You want to choose the best product, but you know, things have to be brought to the hospital, they have to be sterilized. You have to know that they're going to be knowledgeable and there. And so a lot of it too is just efficiency. If I have somebody on the weekend who doesn't do as much orthopedics and they're inefficient, and Kevin's at the back, that's the drill for this, that's for that, it's going to go quicker, it's going to be smoother. You're not going to hand me the wrong thing. And so he sells his company and his product by being there to help us get it done quickly and efficiently. And then that relationship, when you have somebody you're really comfortable with, you know, you really want them there because the whole system's going to run better. Because there's a whole team in the operating room. But I always joke around too, like you spend so much time together in the operating room that, you know, I know surgeons that some of their closest friends are the companies they work with. And I always try to be careful to not get too close to them, because like if I find a really great product or my hospital makes me change, I don't want to think about like his kid's tuition and feel bad, you know what I mean? So you want them to be close, but you want to be so close that you can't be objective if science moves past them, you know what I mean? So.
Yeah, so from the hospital vantage point, I mean, the role we play is we're in the service industry. That's what we do. And our consumers or our customers are obviously the patients, but the physicians are also our customers. And so it's an efficiency play on our end, that if we come in and we're sort of fumbling around and we're disorganized and inefficient and it takes too long for him to complete his case, he's not maximizing his potential, and the patient is suffering and he is suffering as a result of that. So we need to be a place where patients want to come and receive care and where physicians want to come and do their work. Hospitals and healthcare, maybe in general, is an interesting industry and a difficult one, and that very few individuals actually want to be customers. And that took me a little while to fully appreciate that, but very few people actually want to be there. It's not their idea of a good time. And so we have to be delivering a level of service and clinical excellence that stands head and shoulders above the competition. And in an era that we are within healthcare, where there's just incredible transparency and a shift from fee-for-service to really the value of that clinical encounter and keeping people well, people have a choice and there's more transparency than there's ever been before. And so that's really the role that we play, just making sure that we're delivering an exceptional patient experience as well as a physician experience, because the only people that can admit patients to hospitals are physicians, period.
Feeding off the healthcare ecosystem, if you guys could briefly touch on where you think healthcare is going and what it could be evolving to within the next couple of years, and potential roles that can be created within that evolution.
Sure. So we had a roundtable discussion earlier, and one of the things I mentioned was telehealth. I think technology in healthcare is going to continue to grow, but you know, there's the days like the old days where somebody could say, hey, try this or do that, or this is really nice, and no one asked any questions. Things have to deliver value now. Justin brought this up, but like, so if you said you can remotely monitor a patient's blood sugar, decrease ER admissions, things like that, save money. I think that much the way we talked about how COVID, I mean, I think the way you guys were educated changed quite a bit during COVID. By the way, I apologize that you guys got COVID for 2 years during college. It's like the last great time in your life. So that's, I kept telling all my patients, I'm like, hey, don't complain, you're old, at least you're not in college. I literally told people that. So, but I think that we're seeing that sector start to explode, and I think it forced us to, now there's some inherent shortcomings in it. It's not just a virtual doctor's visit. I think it's also what you can do with tracking data and communicating and monitoring things. And so I think that's the area that I think is going to really explode. But I think it's only going to explode if we're proving that it saves money and improves outcomes, because the days of technology just for the sake of technology are done. And you could talk more about, I mean, the margins hospitals run at, they're like slightly better than grocery stores, but their margins are really razor thin. And so any innovation or exciting things we have, if they end up being, you know, prohibitively expensive, they're going to die on the vine pretty quick.
Yeah. No, that's a great point. And so, and COVID has absolutely exacerbated this. But I think what you will continue to see is a shift, and as I mentioned previously, from fee for service, just getting paid for the work that is done, to providing value to the patients, value to the physicians, and so forth. And you're also going to see, from a community hospital standpoint, I think anyway, you're going to see far more niche specialization. The days of being sort of the jack of all trades to all people, we do everything that is a bread and butter community hospital that you'd expect, and just dabble in everything. that's largely going to go by the wayside. You're going to continue to find niche specialization where there are certain services, product lines that people do and they do really, really well, and it becomes a destination center whereby people go and travel to get that care. And people are far more transient than they used to be. And it used to be, oh, my community hospital, if they don't do it, we'll figure it out, but I'm not planning on leaving the community. But if you hear you have an incredible orthopedic surgeon and you got to drive 2 hours to go see him, and another physician is recommending that, more often than not, that patient is jumping in the car and going. That's just how that works. Same thing with cardiac and any other specialty you can name. So you're going to find a lot more specialization. You're going to continue to see healthcare facilities, in particular hospitals, being acquired and working in more for larger health systems. And that's really an efficiency play as it relates to scale. Because there's so much more buying power, not just to the example we talked about earlier with the tongue depressors, when you're trying to purchase those and fill a hospital with blood pressure cuffs, scales, you name it. But in addition to that, and he's not here tonight, but we get to go, and as an example, Mercy Health is a 55 hospital health system across 8 states, and we have 5 in Ireland as well. There's a lot more buying power when you go to the negotiating table with an Aetna or United or Anthem, which are commercial insurers, saying, hey, we want X-rays. But if we were just some freestanding community hospital, 200 beds, we only want to say, hey, we like X, they would laugh us off. And that's only going to continue, so you need to have that leverage behind you. So as it relates to what potential careers there would be that are evolving in healthcare, I think Dr. Ford's spot on that there's going to, especially as healthcare becomes increasingly more complex and there's a lot more social issues with patients than have ever been presented before, we're in less people entering the healthcare field, quite honestly, traditional acute care delivery or healthcare delivery, we're going to need to leverage that technology. How do we do it better, more efficiently, and deliver a better patient experience? Because historically, as an industry, healthcare has been, well, we're going to design this and make it work for us because we deal with this day to day. It's an incredibly clunky system for the patient. And so many other industries have turned that around and say, hey, how do we make this user experience better? And we are just now starting to do that in healthcare.
We spoke about it earlier to the roundtable about just change management, right? We have to continue to evolve and we have to continue to adapt. What got us to this point here today won't get us to the next spot, right? It's just going to continue to change. And we've seen that even within Stryker, the company I work for, right? And we talk about value and what we can do, right? Stryker wants to be like Krueger, like the supermarket. You go down the cereal aisle, what do you see? All cereal. We want all those boxes to say Stryker on at the hospital, right? So what are we doing as a company to be able to do that and provide value to the hospital and to the surgeon? Just recently, Stryker made an acquisition for $5 billion to acquire Wright Medical, right? We're now able to specialize in multiple orthopedic divisions, essentially, plates, screws, nails, shoulder replacement, hip replacement, knee replacement, and have a hospital go just to us, right? And have all those products on the shelves be just to us, but be able to provide the same value that we did beforehand, right? So continuing to evolve, continuing to adapt, and as these hospitals scale, so is industry.
Now, Justin, I know Mercy Health has a relationship with Miami University, more specifically the sports programs in Miami, but if you want to touch on how that relationship could possibly evolve or translate into more of an academic or student-related relationship?
Sure. So, yeah, I think it's going back a few years now. I want to say it was around 2015, 2016. Mercy Health at the time, it's now Bond Support Mercy Health, partnered with Miami. And it was really initially a partnership around providing sports medicine coverage for the intercollegiate athletics. And that's been great. We do that very well and have for many, many years, and that's working well. But the other thing that we've really just started to gain some traction on as it relates to Miami are the potential future academic partnerships. And in its simplest form, this is a good example of that exercise today, just being able to come in and talk about, hey, here's where we think the industry is headed. Here are things that we really need to prepare for the workforce of the future because it's changed rapidly. And we were just discussing this earlier. I mean, just the COVID pandemic in and of itself has caused a reprioritization of, professions and personal lives across the globe. And people are making different choices and they're far more transient. And very honestly, the workforce is getting bored more easily. They want to come in and do something for X number of years, and after 3 years, they feel like they've learned that jump to something else. And so we need to figure out how we, as a healthcare industry, whether it's Mercy Health or anybody, how do we have that pipeline? And how do we maintain that stickiness to our own associates, that they feel very much bought into the culture of what we're trying to do, that they're afforded opportunities to jump throughout the organization and be exposed to different things. And so we've had a lot of preliminary meetings talking about how can Miami University and Bond Support Mercy Health partner to come up with some of this curriculum. You know, what are these jobs in the future? Can we do capstone projects and stuff like that? And even can I come to a group such as this and pitch forth the real problems that are affecting hospitals today? Say, hey, we don't really know where to go with this. What would you do? And so those are the types of partnerships that we hope to shore up and solidify in the very near future.
Thank you. Now, kind of touching off or building off that healthcare ecosystem, we spoke earlier at the roundtable about the struggles some students might go through between choosing, for example, a pre-med or biology major or a business track, and kind of how they intertwine. So if you guys want to discuss how they intertwine within your days of work, and kind of, if you could go back, what classes you would take to kind of help you with that, or what classes you don't think really benefited you at all?
I gotta be careful what I say here. So, you know, I mentioned earlier that if I had a do-over, I would have become fluent in Spanish, where I don't have a huge segment of Spanish-speaking patients. I think a lot of people, you take, you know, a few years in high school, you learn a little bit, and then you take a couple years in college or whatever, and you're like almost fluent. So you're like, you know, in spring break in Mexico, pretending you know Spanish, you understand some, and then you stop. Like, that's it. That's it after Cancun, right? So I think being fluent in Spanish would be really useful for someone providing clinical medicine. From a business standpoint, I think that it would be better for everybody if I had learned to evaluate contracts and understand insurance better and other things. I think the depth that we go to in a lot of our science classes is beyond what we need. You know, I think like we have these classes, and we discussed this before too. If I take a student who's really interested in surgery and we're in the exam room examining knees and I'm teaching this is an ACL, this is how we do it, the technology is exciting, the OR is overwhelming, but you know, you get used to it. And I think it could be like really good feedback if this is what your job looks like. I think when you're in an organic chemistry lab and I'm like making this white powder and there's titrating stuff, I mean, I don't know what any of that stuff was. I have no idea. Did I need all those chemistry classes? No, not really. I would have been better off doing other things with that time. And so I think that to go into clinical medicine, you have so many prerequisites and requirements that take up a lot of your time. And I think you lose the ability to take either classes you just enjoy or to understand the business side of things. So like, I'd literally never been in this building until today. I went to school here for 4 years. I've walked by it a few times, literally have never been in this business school. And so I think if you're training somebody to be, you know, busy clinical, you know, physician or PA or therapist or whatever, there should be some required business curriculum too. It's kind of crazy that it's not. But then the downside though is that, say I learned it and I had a really, really dynamic class and a great professor, 4 years of med school, 5 years of residency. If they taught me a lot about billing, coding, insurance, you know, malpractice insurance, contracts, all the stuff that I had to learn the hard way or like just learn on my own nights and weekends, it'd be hard to remember that all those years later. And so you almost need some refresher sort of. So, but again, we talked about at least you understand the language and it would like, you know, it sound a little bit familiar, you know, when you come back to it. So, and then we talked about too, you know, places like non-traditional applicants too. So like, it was just easy to do a biology degree to get your prereqs out of the way, but anybody who's interested in other things, you're gonna only be valued more when you sit in front of somebody interviewing you for a job. That's just on the clinical side. I don't know how you guys feel. It may be totally different for you hiring somebody, obviously.
No, I really don't think that it is. From our vantage point, you know, if you've got to the point at an interview process and the resume's in front of me and you've passed the litmus test, if you will, you've got to this point you're a qualified enough candidate. You know, for me, I'm really trying to assess your intellect and passion and your integrity, quite honestly, because I want somebody who's going to be wholeheartedly bought into the mission of what we're trying to do. So I think the advice I would give, I totally agree with healthcare finance. I mean, having at least a foundational understanding of what that is, and it's incredibly complex, and I learn new things each and every day about it, and it's what I do. But having a foundational understanding of that, and then share organizational behavior, and in particular, leadership. And I had this conversation just previously at our last roundtable, and you know, there are a bunch of really, really smart, motivated people that work at my hospital that got into healthcare because they fully believe it's a calling and they're there for the right reason. But it's always surprising to me at sort of the deer in the headlights look I get when we've got to make some sort of tough operational strategic decision or have a crucial conversation about something across the board, you know, directors, managers, physician executives, you name it, and their ability to be comfortable in having that conversation. And the tack that I've sort of taken over the years, that's at least worked well for me historically, is I've come to appreciate with most people in healthcare, but in particular physicians and surgeons, is they're scientists, they're data people. And if you embrace that level of transparency and sit down and have a conversation and say, okay, doc, I understand you're trying to do X, Y, Z, better clinically, better for the patient, but here's where I'm coming from as a local hospital administrator, and what our reimbursement is going to be, how we need to do this differently, and then just have a dialogue. And if you can do that and establish that foundational trust and rapport, which is a leadership imperative, in my opinion, you'll be far more successful for it.
Yeah, I would think change and change management is something for sure to get a good grasp on, especially within the healthcare ecosystem. I take really a direct route for my major and for sales. So I want to say I came into the business school and I was thinking, you know, maybe, you know, accounting or finance after a couple of classes that, you know, I didn't like it. I was like, well, maybe management, right? Management, I get a little bit taste of everything, and getting into sales, I know I want to be able to manage people. So from the management side of things, I think that's an absolute critical piece for sure to continue to dive into your management and leadership skills. Sales is something that I kind of say that you're the CEO of your own territory or your own team, right? So you get to dictate what you do, what you put into it. And when you have that kind of mindset, I think that can really take you in many, many directions. But again, I think change management and leadership are the two of the very important classes. And if you can tie those into healthcare, it would make you even better, more full-rounded student. From standing out off the paper, I like to see well-rounded students. But you know, work hard, be smart is half the battle for me. If you come in and you want to work hard and you want to come out and you want to grind and you want to be, you know, you want to be successful, a lot of times you can see that just from sitting across from somebody. So you know, do all the little things you can, tweak the resumes, go get that extra help, go sit down with somebody, and it will pay off in the end.
Thanks, guys. I know we had a minor logistics error with the network event, so I'd like to leave a little extra time at the end for the students to ask questions. I know we have a lot of passionate students as well as people just interested in opportunities within the healthcare realm. So before I open up the floor to questions, do you guys have any last final words of advice or anything you said?
No, I mean, I think, well, if anybody ever has any questions about career stuff, feel free to reach out. You guys are welcome to pass along my email. I think, you know, if you guys are looking at career things, you know, I think one of the things that I undervalued is the importance of relationships. Like if somebody walks up to Kevin right now and says, hey, I'm graduating, I know you don't know me from anybody, can I come spend a couple of days with you? I'd love to see what you do and maybe work in your territory. They're always looking for people. And like, I don't know, I'm just not a forward person. I don't like to bother people I don't know, but I think that as you guys start looking for jobs, I think relationships are huge. I also think if you find an area you like and you stick with it. So case in point, a guy that played football here at Miami, who was a good friend of mine, actually worked for Stryker in Chicago in medical device sales. And do you guys use Case Check at all? I don't think they're in Ohio Health, but he created a company. So he was bringing these trays in and they were losing them and there was all these issues. So he created an entire company. He's got employees now in Chicago. He didn't like dealing with the mood swings of people in the OR and, you know, having the weird hours. And so he pivoted into a space and he's CEO of a company now based on that. And he really liked the idea of surgery, but he didn't want to be in the ORs anymore. So I think your relationships are important, and I think you guys need to be ambassadors for yourself as you move forward.
The thing I would add on to that is just, you know, pursue something that you're passionate about. I mean, there are very few people when I'm going down to hospital orientation and introducing myself to the new hires where, you know, I ask them, so why did you choose healthcare? In fact, most often when I ask that question, there's always a personal story. Well, you know, my mom was really ill, or I was really ill, or I got to go to a hospital and interacted with a nurse or a physician, and it just was really profound. I mean, these people that get into healthcare for a reason. It is a true calling. So just make sure that you're passionate about what you do, because I will tell you, certainly coming from the hospital realm, you know, we think we're all having bad days rolling in there, and we all have lives outside of that. Everybody holed up in that bed is having a way worse day. And we can't lose sight of that. And that grind that Kevin was referring to, that can wear on you a little bit, but you just have to make sure that your priorities are consistently aligned. That, you know, we're here, there's a mission behind this, and that is somebody's mom or grandmother or son or daughter in that bed. And that is an incredibly awesome responsibility. And it is a privilege to do what we do on a daily basis, but it doesn't make it easy. It does not make it easy. And then the last bit of advice I would say is just follow through. I'm blown away more often than not by individuals that do what they say they're going to do and follow up. I mean, your word is everything, and everything you do personally and professionally. And when you come in and you know, do something and you deliver on a promise, or if you don't deliver, you own up to that. That says something about your character and integrity that speaks volumes, regardless of what profession or career track you choose. So show up. That would be my advice.
Yeah, I would say, I would echo that. Do what, at the very, very simple terms, do what you're interested in, right? Do what you're passionate about. I was passionate about helping people and sales. So first I was like, oh, you know what, criminology, right? Maybe a police officer, right? Uncles are in it, chief of police officers, and then I knew I wanted to be in sales. And then after going through college, medical sales became more and more as an opportunity. And then you start thinking, well, I was always interested in why my dad and brother were both carrying diabetic pumps, right? They were both diagnosed with juvenile diabetes at the age of 13 in the month of April, within 3 days of each other. Growing up with them, seeing the insulin, the syringes, glucose tablets, and it was always, you know, how is this evolving? How can we make them better, right? And that's where the healthcare, the medical side came from. So at the end of the day, I'm in the OR, I'm helping patients, I'm helping the surgeon, and on the side I'm also selling, right? So I stayed true to what, you know, I wanted to do, help people, and get into sales. So that's the very base level, and the way you get there is never straight. So, you know, again, my one piece of advice, I started off in, I think, finance, then went to accounting, maybe a week or two in marketing, and I ended up in management, right? So it's never a straight road, but if you stay true to yourself and your core, you guys are gonna do great.
Cool, thanks guys. So now we have about 15 minutes left, so I'll open the floor to questions. Like I said before, I know there's a lot of people here that are just interested in the healthcare system or business outside of it, or maybe some capstone students that possibly ask all three of them, or even Kevin specifically, he was a Stryker, and Stryker is working with Miami for the capstone, so by all means, please ask away.
So you made a comment that Stryker is kind of trying to be like Krueger in the sense that like all your products are in one place. And then there was a separate comment about how there's more niche specializations nowadays where people are driving 2 hours to a specific person that's really good at this. Do you think that competitors are thinking the same type of thing and trying to be more like the Krueger example and like have all their products there? Or are the majority of Stryker's competitors focusing in on those like niche aspects of certain technologies and trying to build themselves an outlet?
Good question. I think it's a little bit of a mixture, but a lot of these companies that want to continue to take it to the next level and continue to grow will look at these smaller companies and try to acquire. Kevin Lobo is our CEO. Kevin Lobo is called in the business world the serial acquirer because he sees these small companies out there that have value and he goes up and gobbles them up, right? And he gives the sales team the opportunity to go and sell those products that had that small company take off, right? Which is exactly what a sales representative wants, right? A CEO that is going to go out, that's hungry, buy a company because they are that good, and that their market share is that good, and their marketing is that good, right? So I think it kind of goes hand in hand. If you're a real small company and you got a great product, there's an opportunity that you're probably going to get bought out by a larger company.
So I think that the niche specialization we're seeing more in clinical practices. So hospitals, if they want to have like a labor and delivery unit or cardiac surgery, both great examples, you have to have this massive team there. So if you have, you know, if Justin has, how many hospitals are you taking care of? I mean, Mercy, you said, how many? If you have multiple that are close together, you want to have specialties because it runs better and it's smoother. It's just basically supply chain. So if we have a hospital, so when I worked at the Cleveland Clinic, we try to do a lot of our total joints in one hospital because we have, you know, the whole team's there, we have the implants there, and it's so the therapists are the best, everything's geared towards them. The rooms are set up for people going through those recoveries. So the specialization is really good for clinical outcomes, and it's better for the bottom line too, because you don't have to keep a cardiac team on call. You know, if you do a heart surgery and they gotta have a take back to the OR, they gotta be ready to go quick. And so you have to have, it's like a level 1 trauma center. You have to have a neurosurgeon, vascular surgeon, orthopedic surgeon in the building. And so you don't want 10 of those. But the Krueger aspect of it is, like the hospital saying you're gonna need 2 vendors, right? So if we have 2 vendors for orthopedics, and I just use orthopedics as an example for everything, because that's what I do. But if they say you have to use these 2 companies, if somebody designs something fabulous, I might not even be allowed to use it. So that's where the companies buy them up. And so Wright Medical, who they just acquired, may have said our market share is shrinking every year because these hospitals are saving money by buying in bulk. So if you say, hey, with 55 hospitals, if we can give you X number of surgeries, the margin goes down, but the number goes up, so they're willing to sell them cheaper. And so the small companies are getting acquired by the large companies. So the companies are the Krueger, and then we're trying to have hospitals that are more specialized based. I don't know if that helps at all. So, but I think it's kind of, but it's almost conflicting ideologies in some respects. Yeah, you can talk about it.
You know, everything you said, I agree with. I mean, it's exactly about the clinical specialization on the hospital side, but very honestly, you know, if we were going to be, my facility is going to be an orthopedic center of excellence, a destination center for orthopedics. I really want one product, assuming that product can fit all the needs for our patients and it meets the surgeon's needs. I'm good with that. What I don't want is a laundry list of various products, because I can't leverage the price point of those. So if I can simplify it, get down to 1 or 2 vendors that meets all of our needs, that will improve our margin as it relates to those particular cases. So niche specialization clinically, but single source or dual source maybe, depending upon the vendors.
This is for Kevin. So you mentioned that it took you a little while to get into medical field. What was the process like of gaining all that new knowledge and then feeling confident to go into the OR with someone that's been in surgery for years?
Yeah, so it took me a little bit to know I wanted to get into medical sales. I was fortunate enough to be able to get hired right out of Miami and went right into Stryker. But in those 4 years was where it was a little of a windy road. I always knew, like, and also it was one of those things where I shadowed, right? So I went and I said, hey, I went up to somebody, I really think I'm going to be a good fit in medical sales. Can I come shadow you? It was a general surgeon who was doing a hernia repair. I don't do those, don't sell anything anywhere close to that, right? So, but being able to go in there, stand over a shoulder, see a patient cut open, see blood running out, and not passing out going forward, that's the first step to knowing that you're okay in the OR. So again, I think, you know, a little bit of a windy road, but.
How long did you follow other people around? I mean, how long were you in with Stryker before you covered your own case?
Oh yeah, so I mean.
And you could cover like an ankle fracture pretty quick or whatever. I mean, but
yeah.
I think maybe you could tell her more about
elaborate a little bit. Yeah. So it does take. And again, you guys are in a great spot because I was business and I was then studying after college the healthcare side, the medical side, right? So. Going into it, it could take 6, 8, 9, 10 months in order for an associate maybe to become a rep, right? And during that time, you're shadowing multiple reps in multiple areas, right? Cleveland, Akron, Canton, Youngstown. You're trying to see as many surgeries as you can. Why? Because every surgeon does it a little bit different. Brett does it a little bit different than so-and-so downtown at the Cleveland Clinic. Cleveland Clinic doc does a little bit different than the guy at UH, right? So that also makes you a better rep because of the repetition, right? But also you can provide value later on, knowing that, hey, I saw it a different way, and if there's a surgeon who is okay taking advice, some aren't, which is an interesting conversation. You know, it just helps you out dramatically.
It's an understatement. But yeah, I think that, so if you look at what Kevin does, some of the stuff is fairly straightforward. So if you look at, take a surgery, so like we were talking earlier, David broke his clavicle snowboarding, I broke mine playing hockey last year. If you look up the Stryker tray, it's gonna show you the size of the screws, the drill bits, a technique guide, and you can go through that and memorize it, just like studying for an exam, right? Then you gotta figure out how to go in the OR. But so say you start covering a specific person and you're very familiar with their preferences, they may say, hey, she doesn't have 20 years of experience, but she's helping out in the OR. She knows me, she knows my practice. You're motivated, you seem intelligent, so we'll see the upside and generally would say, okay, this is an asset to have here. Where it gets tricky is like if somebody's like you know, I had a patient who had a rod in their femur and they broke below it. So we had to get the first rod out. And then it's like, you're using every trick in the book. And so throwing a new rep into that OR is, you know, it's like, well, I saw someone do this once or whatever. And that is not really fair or safe. So you hope that your team gives you a graduated exposure to that. And surgery is the most extreme example where somebody on the industry side is going to be in like a high stress environment. So.
We have time for probably one or two more questions, so does anyone have anything else? No? Sorry.
And again, if you guys have questions after, come up, you know, find us, I'll be happy to chat with you. I know there might be some more Stryker questions just because of capstone stuff, so I'll be happy to chat with you.
Yeah, and if anybody has, like, if you have career, you're interested in being a PA or nurse or any, you name it, you know, if you want some experience exposure to that, I know people all over the place, obviously Dustin does too. So I think that you can really, and same thing with following someone like Kevin around. I think if you have one experience, like a teacher who's not dynamic but has an interest in the topic, you might not have a good experience in that class. If any of you guys want more experience, see some stuff, get some exposure, reach out if we can help you with that, we're happy to.
So I want to thank these folks. For those of you who don't know me, my name is Terry Barr. I'm a professor here in the marketing department, and I just want to plug an opportunity that some of you may not know about. We are starting a healthcare sales certificate program that will be available to students starting in the fall. So if you have an interest in healthcare sales, whether it's with medical device or pharma, medical nutrition, there will be an opportunity for you to specialize and gain a certificate that could allow your resume to rise to the top of the pile. We were all talking about that earlier, that, you know, what can you do to get Miami students more visibility in these fields? And that's a way to do it. So if you have an interest in that, reach out to your advisors. You can always reach out to me. I also was the advisor for the student organization, so feel free to reach out.
Yeah, kind of going off that student organization, it's something Olivia and I were able to start with Dr. Barr, so if that's something that's of interest to you guys as well, we can leave our emails up here, you guys can reach out, we can more than happily help you connect to it and get involved. And then to wrap things up, I just want to thank our guest speakers one more time for coming out and speaking today.
Thank you.